What does the current scientific evidence show about the relationship between acetaminophen and autism?
Something that has been studied for close to decades at this point. A lot of this information and this cause, it comes from a recent study that reviews older studies on a connection between the use of Tylenol or acetaminophen in pregnancy and the outcome of autism. Now, important to note that even the authors of that study that is referenced have gone on to state that that study does not prove what we call a causal link. It does not prove that Tylenol causes acetaminophen. Important to remember, two things can exist in time, does not necessarily mean that one causes another.
So do I hear you saying it's a new review of old data?
It's a new review of old data, and important to note that there are many reasons why a pregnant woman might use Tylenol in pregnancy, and some of those reasons might be connected to neurodevelopment of a child. For example, fevers during pregnancy, so important to manage. An uncontrolled fever increases risk, stress from pain. All of these reasons are reasons why it might not necessarily be a cause and effect, instead an association.
Educate us about leucovorin, a cancer drug, as a potential autism treatment, because that's going to be talked about as well.
It will be talked about. Another headline, leucovorin is essentially folate, vitamin B9. It's encouraged that pregnant women take folate early on in their pregnancy because we understand that that can assist with neural development. Now, in this report or in this statement, they're alluding to the fact that leucovorin might be a quote-unquote cure of autism. Important to note, autism is incredibly complex, environmental and genetic factors, nearly 80 genetic factors that can lead to an inherited autism link. Reasons why stating that there is a cure to it, it's just simply implausible. So it's important to note that when we look at the evidence, we try to not draw these big associations from these very complex, minute variables within the research.
And in fact, experts had said, in fact, the expert we just heard in that story said that the use of Tylenol has actually, and acetaminophen, has declined over the last few years. So how does that fact mix in with the thought that now we're saying there's some causal link between
While
the two
autism has
things?
increased
Exactly.
at the same time.
Exactly. Important to point out that the use of Tylenol has decreased in recent years while the rate of autism has increased. Now, both of these factors are not a reason why you can say yes or no. But beyond that, there's a larger study from 2024, looks at nearly 2 million children, and it found between siblings that those who use those who use Tylenol, those who did not, there was no association seen. An important reminder of why research evidence is so valuable and important.
Are you worried that pregnant women will avoid using Tylenol during this time based on this recommendation?
Absolutely. As an emergency physician in the ER, I remind pregnant mothers that our job as physicians is about risk reduction. There's no way to risk eliminate. And what that means is that you want to make sure that you're using interventions, understanding the risk and understanding the benefit. The American College of Obstetrics and Gynecologists, the leading institution that we lean on for direction in terms of management in pregnancy, still continue to recommend Tylenol or acetaminophen as one of the safest options to manage fever in pregnancy. Important to understand that an uncontrolled fever in pregnancy brings incredible risk.
Yes.
Well, this just seems to me, this announcement and the questions surrounding it is likely to add to some of the confusion already because of the mixed recommendations and thoughts about vaccinations.
And criticism.
Yeah, and that's why these statements are really important. They can fuel misinformation. They can also fuel stigma. By stating that there is a cure to something as complex as autism, creates this idea that it can be erased. That is not the case. Autism has existed since the beginning of time. We just did not have a name for it. So it's important to understand those factors when making discussions or having discussions about these crucial topics that affect families each and every day.
We don't want confusion. We'd rather have clarity.
Exactly, based in fact.
All right. Thank you, Doctor. As
Thank
always,
you.
appreciate it.